Good afternoon, everyone, and welcome to our live medical show. Every Sunday at 12:30, we're going to be with you, and I hope to bring the latest medical news to you. We have a very special guest, which I will introduce in a minute. But the topics today are special, and they're all newsworthy because, as you know, we just finished September, which was Prostate Cancer Month, and we're diving right into October, which is a breast cancer month, and today is the first day, and I thought this was a really perfect way to open up the topic for Breast Cancer Awareness Month. And I couldn't think of anyone better and more qualified and closer friend than Dr. Lauren Cassell, who is the Chief of Breast Surgery at Lenox Hill Hospital. We have a pleasure and honor to have you, Lauren. Welcome to the show.
Thank you for inviting me.
So what I've learned over the years of working with Lauren is that she's not just a surgeon. And most surgeons, as you know, they have a little tough bedside manner. But what I learned, and she is taking care of some of my patients and close family friends. She has a big heart. She's a great human being. And I think that's a great plus because you can't just take prostates out or breast tissues out. She has a heart, and she's passionate about what she does. And she's been in the field for so many years that she's experienced enough to talk about breast cancer.
Thank you.
Lauren, as you know, we talked a little bit about statistics of breast cancer in America. Close to 250,000 women are diagnosed with breast cancer this year. And despite all the screening and things that we talk about, we still have about 40,000 women that die from this. What's the latest in breast cancer? And our audience want to know who is really at risk.
You know, David, thank you for asking. It's a great question. First of all, every woman is at risk by virtue of the fact that she is a woman. There are certain things that we do look at. One is family history, which plays a very important role, though it's important to remember that most patients who develop breast cancer do not have family history. So you are still at risk even if you do not have a family member who has had breast cancer. It's important for your physician to take a history of breast cancer and also related cancers, which we'll probably mention later. Anybody who's had breast cancer previously is at an increased risk. Patients who have had radiation therapy to the breast, or I actually mean to the chest area, at a young age, who've had Hodgkin's disease are at increased risk, require surveillance. Patients with breast tissue are also at risk.
So it's interesting because when it comes to my field, we have so many guidelines, and these guidelines are constantly changing, and it's almost mobile to a point that, like, you know, patients out there are confused about screening for prostate, and I know it's very similar to what's going on with breast cancer. When should somebody, a woman out there that's listening to this show, when should they get their mammogram?
Good question. There has been a lot of hoopla and a lot of discrepancy about what to do. I think most of us are in agreement that patients should start screening mammograms by the age of 40. They can also have what are called 3D mammograms, which are usually available in most facilities where they're able to sort of cut through in layers the dense breast tissue. Sonograms may also be offered if, in fact, the patient does have dense breast tissue. The other thing is, if there's a family member who has had breast cancer at a young age, what we do is we start screening them 10 years before the earliest member.
So you're saying that if someone has a high risk and they have family history, they should really start
possibly earlier.
Early 30s. Are there a lot of women out there in their early 30s that are diagnosed with breast cancer and aggressive ones?
The numbers are small, but unless we pay attention to those who are at risk, we're going to miss them.
Okay, you mentioned something about 3D mammograms and on ultrasound, and we'll have an expert coming in next week. Dr. Nicole Sapphire will talk a little bit about imaging. She's from Sloan Kettering. She'll be coming in next week. But when do we ask for ultrasound, or what's the indication of getting an ultrasound? Is it like a cyst versus mass or lump? What happens when they get mammograms?
If there is something seen on mammography and it's unclear whether it's solid or cystic, a sonogram can clear that up. And the patient can, if necessary, have a biopsy done under ultrasound guidance. So it's important for that.
Okay, so now they have had the biopsy and they find that they have hopefully a localized breast cancer. Before we get into the treatments, which we'll talk in a little bit, tell me a little bit about the health and, you know, whether obesity, smoking, alcohol, our lifestyle, how is that, you know, is going to increase the risk of breast cancer?
You know, some of it is obviously in our genetics, and we have ways of evaluating patients genetically. We look at their history. If it's appropriate, we do genetic testing. We're able to test for not only the BRCA gene now, but we're able to test for less common genes. If the patient does have them, we're able to offer them risk reduction surgery should that be indicated. If in fact they don't carry a gene, there are other ways that patients can decrease their risk. One is obviously to maintain a healthy lifestyle. And one way is to keep your weight down. In the postmenopausal patient, the estrogen that we develop is from our peripheral fat. So the more fat, the more estrogen, which can feed estrogen positive tumors. We talk about exercise. Aerobic exercise 4 or 5 times a week can decrease your risk as well and helps you for other things as well. The other thing is vitamin D. Decreasing or limiting your alcohol intake. They say the more you drink, the higher your risk. So they talk about decreasing your risk by drinking 1 drink or less per day.
Okay, so that's a very important point that she's bringing up, because most of the studies are showing, and I agree with you 100%, that smokers out there have to be really careful. If you're drinking a lot of alcohol, you're at risk. Obesity certainly plays a big role because of the conversion of estrogen, etc. And also, I read somewhere that if you really have early menstruation and late menopause, and that longer exposure of estrogen is another risk factor that you have to be careful. And you mentioned the dense breast tissue, etc. Obviously, you're at the advantage in your field of breast cancer than my field, because in prostate cancer, it's interesting. The way men and women think are totally different. We are kind of shy. We don't want to really talk about it. We keep everything in hiding. But there's a big celebrity factor in your field, and we've had, TV anchors in the past. We certainly have Angelina Jolie, who really was a big factor. And I think after she came out, talk about this BRCA gene, and she went ahead and got the double mastectomy. This was a big disfiguring thing. But we learned from her that the feminine part and breasts are not a symbol of just feminine. It goes a lot more than that.
The important thing that we actually learned also is, one, to identify who's at risk by evaluating patients for a breast ovarian syndrome, finding out what their risk is, and actually being able to offer them risk reduction surgery and maintaining their appearance. We have had tremendous advances in our reconstruction. One is the sparing of the nipple areolar complex.
Well, I want you to wait about the treatments because I want to come back for the whole segment for that. But, I think, for example, this week we had Julia Dreyfus, who is one of my favorite comedians, and I actually grew up watching her. She came up with breast cancer diagnosis, and they go public, and they have brought in tremendous awareness to breast cancer, which is really great for you and the field, and a lot of work is done. Tell me a little bit about that celebrity factor, because I know you've taken care of a lot of important people in your career.
As David and I had discussed, I had the good fortune of taking care of Robin Roberts. And she did decide to go public with her diagnosis, and thank God she's well. And what a delightful, wonderful person she is. But you have no idea how many people, because she went public, went and got their mammograms, were found to have things that needed to be taken care of, and how she elevated the awareness and the treatment of breast cancer.
I think what I hear from you is that being diagnosed with breast cancer should not be the end of the world, that we have many ways to diagnose it early. When the cancer is diagnosed early, the prognosis is excellent, and you have over 90% survival.
True.
Correct me if I'm wrong.
Absolutely.
And I think that knowing that answer and not being scared and go for screening and understanding what you have, that's power. And I congratulate you, and I congratulate a lot of women out there who fight for their mammogram, who don't let the guidelines get on the way of their health. And that's something that we all have to learn. All men out there need to learn how to do this and take care of themselves. So we're going to take a quick break. I think when we come back, I'd like to talk to Lauren about what treatment options are out there, touch base on certainly BRCA gene and how that plays a role in not only taking care of your breast, but also sometimes these BRCA genes can play a role in removing ovaries because they can increase the risk of ovarian cancer. and also touch base on some of the plastic surgeries and cosmetic surgeries, and how with some of the implants that we have, women out there actually look fantastic even after major surgeries. We'll be right back. We take a quick break and we'll see you in a minute. Welcome back, everyone, to our live TV show. This is continuation of what we had on every Sunday. So many of you have written an email to me that we want this show back, so we're live online, and you can actually watch us on your cell phone. And this is a way to give back to the community and bring you the best medical knowledge and latest research by experts in the field. Today we're talking about breast cancer and so many advances, and we see celebrities that have come up with this diagnosis, and they're able to pick up the diagnosis, beat the disease, and move on. And October is the month that everything turns pink. Our firefighters are going to wear pink, our football players are going to wear pink, and the whole world turns into pink. And we have our great expert, Dr. Lauren Cassell, Chief of Breast Surgery from Lenox Hill Hospital, is here, who I personally know, and she has taken care of some of my friends and family members and has done an amazing job. You know, you mentioned something about Brocco test, and a lot of people may or may not know exactly what that means. How do you test for it? And if you're positive for that gene,
what do you do?
What do you do, and what does it mean?
First of all, the test is a test that can be either done from a blood specimen or a specimen of saliva. It indicates when you do find that you are a carrier of this gene, you are at extremely high risk for the development of breast cancer and potentially ovarian cancer as well. So we have several options for these patients. One, should they so choose, is just close surveillance. At the very least, we do recommend that the ovaries be removed, including the tubes and ovaries, by the time they've reached the age of 40 or when they've completed their childbearing years. The other thing in terms of the breast, again, we have surveillance, though that does not prevent breast cancer. We just hope to catch it earlier. Or we have what's called risk reduction surgery, which is actually doing prophylactic mastectomies, removing the breast tissue, preserving the nipple areola complex, and reconstructing the breast, either with the patient's own tissue, which was fat from the abdominal wall or from the buttock or thigh, or using implant reconstruction. These patients have up to an 85% lifetime risk of developing breast cancer. And by using these risk reduction surgeries, we're able to bring it down to single digits. Not zero, but single digits.
So should every woman out there at the age of 40 and above should be asking for this test? Or if only if you're at high risk, or if you have strong family history, or if you find something on mammograms?
It's really only high-risk patients. It really would be excessive to test everybody at this point.
Because of the cost.
But the cost has come down a lot. I mean, it really is, to do full sequencing for breast cancer risk, it is less than a few $100s at this point. So it's not as prohibitive as it had been previously. That being said, some patients don't necessarily want the information. But patients who are young, before the age of 45, Ashkenazi Jewish, bilateral breast cancer, family history of breast and ovarian cancer. These are all things that are suggestive of a possible breast ovarian syndrome. However, even patients who have strong family histories, the gene only accounts for 5 to 10% in these families. Except for the Ashkenazi Jewish population, it can be as high as 30%.
For the record, she's also Ashkenazi Jews.
Yes.
So, and I'm known from Sephardic Jews, but
The
that's a whole different discussion for another day. Tell me a little bit about like latest surgeries and you know, the reconstruction. And I know that you combine a lot of your work with plastic surgeons and you do major reconstructions. Does it really look natural after these mastectomies? What do people expect if they're diagnosed with breast cancer?
First of all, I think, as I said previously, most patients are candidates for breast conservation, which means just removing the lump and testing the lymph glands under the arm. That's followed by radiation therapy and any type of adjuvant extra treatment that is indicated based on that patient's personal history. We are able to do what's called oncoplastic procedures, where we recontour the tissue to make the breast look just like it did. As I say, I tiptoe in and tiptoe out, hide the incision, looks great. The other thing we're able to offer the patient is something called a Sentinel lymph node biopsy, which means not removing all the lymph glands under the arm, just the first draining lymph glands, and therefore we're able to avoid swelling of the arm, which is lymphedema.
Well, that's a big deal.
Big deal, big deal. Numbers go way down. And the other thing we're able to do now is in patients who choose mastectomy or require mastectomy, we really are able to leave them looking like themselves. And now that we can show them pictures of what other patients have gone through and look like, they're not afraid.
So I think the message that we are getting is that there is life after breast cancer. If you're diagnosed, obviously look for experts who are really able to remove the necessary tissue, but also with cosmetic surgery you can have not only the look of it, but also the cancer is removed. Genetic obviously plays a big role, so even Oncotype DX and a lot of genetics that we're using to look for recurrence has come not only in my field, but I know it also plays a big role in your field.
Very important.
I want to ask a question. We have a question that's coming in. And by the way, if you want to ask any question about breast cancer, and if you want to ask questions about other topics, you can go to my Twitter and Facebook, and you can send your questions now, and we will answer them live. I have Maria is calling from Arizona, and is asking about the role of soy and whether too much soy is a problem, or if you is it a higher, does it increase the risk of breast cancer if you consume too much soy?
You know, it's a good question with not a definitive answer. What I can tell you is that small levels of soy, lower levels, what you may normally use in your diet, may be beneficial because it's a phytoestrogen. However, if you start adding large amounts of soy, that phytoestrogen starts acting like estrogen. So you don't want to pack it on. Normal, small, regular amounts, a little soy milk in your coffee, in your cereal, that's fine. Don't go crazy.
Don't overdo it. So that's the answer,
Moderation.
Maria. Exactly right. So a little bit. I have one more question, and this comes from New Jersey, from Helen. She's 35 years old. She recently got breast implant. Doesn't say in the email what kind of breast implant we're talking about here. Should she worry about this implant masking future breast cancer? Do we have, through the mammograms or 3D or MRI imaging that we have, can we go around this implant and make sure that we detect any future cancers for her?
Our radiologists have really become pretty good at evaluating the patients with implants. I don't think there's a reason to remove your implants. What they are able to do is actually displace the implant. So you do have to take multiple views of the breast with the implant in place and with it displaced, but we do get a pretty good look at that breast, and in addition, ultrasound. So I wouldn't be too fearful about it.
That's wonderful. That's a great news. Lauren, I want to appreciate you being with us. I think a lot of people learned a lot from you. Certainly this month, I know you're going to be very active, and because of the Breast Cancer Awareness Month, we're going to basically put a lot of articles out there, new things about diet and how that can change your life. So I think your presence today made a big difference, and I appreciate you being with us. Thank you again, and I'll see you around the campus.
And I thank you for inviting me.
Of course, it's a pleasure having you. We'll be right back after this commercial.
Celebrity health stories create teachable moments for everyone. There has been a lot of press surrounding breast cancer, while prostate cancer receives far less. Surprisingly, both diseases share many similarities. There will be an estimated 232,000 new cases of breast cancer diagnosed each year in the U.S. For prostate cancer, it is 233,000. 1 in 8 women will be diagnosed with breast cancer. 1 out of 7 men are diagnosed with prostate cancer. Breast cancer is the most common cancer in women in the U.S. Prostate cancer is the #1 cancer in men in the U.S. Each cancer accounts for about 14% of all new cancers, with a new case diagnosed about every 2 minutes. The average age at diagnosis is 61 for women and 66 for men. There are even many pathologic similarities. Each has gray zone diagnoses and precancerous lesions. Some even share genetic mutations, such as in the BRCA gene. Each has multiple treatment options, with surgery considered definitive for early disease. There is effective screening for each. For women, it is mammogram and physical exam. In men, the PSA blood test and physical exam are important. Talk to your doctor about which screening methods are appropriate for you. Get screened. Consider a second opinion if there is any doubt with your diagnosis. Early detection and patient empowerment are critical. Be your own advocate. Women, please encourage the men in your life to get his PSA checked. It can save his life.
Welcome back to our live show. This is a weekly Sunday show that you can watch online. We're on Facebook, Twitter, and our YouTube. But you can also go to drsamaditv.com and you can send your question live as we speak. And I will be happy to pick a few of them and answer them. This is an open microphone. It's all for the public out there to give a community service. This week, as you know, it was a National Coffee Week. And you've heard me for years talk about the coffee and the importance of coffee and how it could be beneficial to you. We also, you heard me talk about the fact that you need to have at least 3 to 4 cups of coffee a day in order to get the benefit of this. So the question that's coming online is, what size coffee we're talking about? I usually recommend 6 ounce, which is a small cup of coffee. I don't like to add sugar or milk to it, because if you take 4 cups with all that sugar, that's not really good for you. So we're talking about black coffee. Now, everybody knows that coffee is a stimulant. We know that it boosts your performance. I personally drink a lot of it in order to be able to be awake and perform my surgeries. But there's a lot more to coffee than what we see. Not only it increases your metabolism and burns fat, but it also has tremendous amount of antioxidants. All the phytochemicals and polyphenols that are in coffee is extremely important to clear all these free radicals in your body that can lead to diabetes, to Alzheimer's, to so many other things. So that's really important. Now, you've heard also that I say that by coffee you can become happier. And you see me smiling now because I really get a kick out of this. It's been proven, and a lot of research, that drinking coffee increases your serotonin and your dopamine. What it means is that these are happy hormones that reduces depression and boosts your mood and makes you happier. But the big question that comes up that people ask online is it really the decaf is as good as caffeinated? Is it the caffeine that's causing this? And the answer is no. The big powerful chemical that's in the coffee, it's called chlorogenic acid. And what chlorogenic acid does, it's been shown that it not only reduces the inflammation, but at some point it can reduce even the risk of many cancers: colon cancer, liver cancer, prostate cancer. So remember, chlorogenic acid is a big factor in the coffee that's important. Now, when it comes to big benefit in our own body, some have written about the fact that it can change the number of and the type of bacteria you have in your gut. We'll talk about the gut bacteria and what it does to your health, but just briefly talking about the fact that there's a whole ecosystem in your gut. There's trillions of bacteria and viruses and fungus that live in your gut. And we talk about good bacteria versus bad bacteria, and that balance is very important. Now, we talk about fruits and vegetables. We talk about healthy diet and exercise and so on and so forth. But coffee and wine can also change the diversity of your bacteria in your gut for better, the good bacteria. So this is a big deal. When you have a lot of sugar and fatty food and high cholesterol diet, you're going to reduce the diversity. It's all these good bacteria that reduce the inflammation, and as a result, less colitis, less inflammatory bowel disease, less Crohn's. You see how coffee is bringing it all together, right? We talk about the fact that it may involve in insulin regulation and reduce the risk of diabetes. And finally, one thing that it's hard to imagine, but it has some protective neuropeptic protection. When it comes to multiple sclerosis, when it comes to Parkinson's and Alzheimer, coffee has been very beneficial. Let me just, before we finish this segment, tell you that there are people out there who should not be touching coffee. Pregnant women should be very careful. They should talk to their doctors if you want to drink coffee. If you're obese and you have reflux, you got to be careful because coffee can actually make it much worse. And certainly if you have osteoporosis, we don't want you to take it because of the acidic nature of coffee. And we talk about reflux as well. So it may increase your heart rate, it may increase your blood pressure. So talk to your doctor before this. Remember, 4 cups of coffee, no sugar, no milk, and that's the way to go. And I hope you learn from the benefit of coffee. Thank you, and we'll be right back after these messages. Are you getting up in the middle of the night many times to urinate? Are you suffering from sexual dysfunction? Do you know what your PSA level is? Have you been diagnosed with prostate cancer? If you have answered yes to any of these questions, please come and see me at our Men's Health Center in the heart of Manhattan. My name is Dr. David Samadi. I have committed my entire life to not only save you, but most importantly, to save your quality of life.
Trust your health in the hands of prostate cancer treatment and robotic surgery expert Dr. David Samadi, because having cancer doesn't mean you have to suffer.
Welcome back to our show. I hope you're enjoying today's program. We've been briefly talking about breast cancer, and we're going to coffee. And finally, all the topics that I pick are the ones that everyone can relate to. And the main purpose of this segment is to talk about vitamins. How many of you out there are taking vitamins? I can tell you that this is a $30 billion industry. 2 out of 5 Americans are taking vitamins. And do you know which one is the most common one? Yeah, you guessed it right. It's multivitamins. The big question is, do you really need this? Are you overdoing it? And what happens if you take too much vitamins? What happens to you? Can you hurt yourself? And that's the purpose of this segment. So what I can tell you is that the best way for you to get your vitamins is through organic food, natural food. If you get 3 portions of fruits and vegetables, if you have a balanced diet, you really absolutely don't need to waste your time and money on taking all these multivitamins. Vitamins come in 2 forms. One is water soluble, that's B and C, and those can get excreted if you take too much of them. But the ones that are problem are the fat soluble ones. These are A, D, E, K that can actually stay in your system for a long time. So I made a list of some of the vitamins that people should take. We know about prenatal vitamins, right? They should take folic acid because it reduces any kind of birth defect. If you're vegetarians and you're not getting enough balanced diet, if you're only taking about 1,200 calories a day and you're on very strict diet, that's when you should be taking some of the vitamins. If you're a smoker, smoking shows that it reduces the vitamin C and D, so you may be able to complement some of that. And certainly when you're older, your vitamin B12 may be low. A lot of times older patients may present with symptoms of Alzheimer. Check your vitamin B12, and by supplementing it, you're able to really take care of these elder men, and it's fantastic. Women who have very difficult menstruation and are losing a lot of blood, maybe anemic, and they should be taking iron with them. If you're taking statins and a lot of cholesterol medications, add some CoQ10 to your list of vitamins. These are essential ones that I found for you. If you're taking acid reflux medications, if you are taking H2 blockers, you're not going to be able to absorb a lot of vitamin B12. These are the patients that I think taking multivitamins and B12 will be good. For men's health, we talk about lycopene and zinc for your prostate. Certainly flaxseed and fish oil is good to lower your cholesterol. And add CoQ10 if you want to reduce bad cholesterol. Taking too much vitamins is not good for you. We've seen that vitamin C too much of it can cause nausea, vomiting, diarrhea. Vitamin A, too much of it can cause liver toxicity. If you take too much vitamin D, and we'll talk about vitamin D next week in details, you can increase the risk of kidney stones, you can increase your calcium. So too much vitamin is not necessarily good for you. They're giving me the signal that we're running out of time. It was a pleasure to be with you. Obviously, it's a live show, so we're running out of time. God bless you. Send your questions on Twitter and Facebook, and we look forward to seeing you next week. Dr. Nicole Sapphire is going to be with us next week to talk about the imaging in breast and breast health. Thank you, and see you soon.